We are in the midst of a national public health crisis, and no one group or government can address it alone.
The national public health crisis the federal health minister is referring to is the opioid epidemic. It's a serious issue that we've been following closely here on The National, one that's had devastating effects on families and communities across this country. And this is why 8 people die every single day in this country from opioid overdoses. And today, the health minister admitted she has no idea when the situation will start to improve. Ottawa did outline new measures to try to turn the tide. The CBC's Catherine Cullen joins us now from Ottawa. And Catherine, what is the government going to be doing?
Well, Ian, Jeanette Petitpas-Taylor does have a long laundry list, 40 different measures that the government has already announced. We're talking about things from new supervised drug use sites to better data collection, but none of it is stopping this crisis. Now she's going to try some more dramatic measures, like a pilot project to give people who are about to take street drugs a safer pharmaceutical alternative. That's already being tried by groups in Vancouver and Ottawa. It is consulting about making it easier to prescribe methadone, and the federal government wants to make it easier to approve those temporary overdose prevention sites, the pop-up tents that we've seen in some cities.
So the health minister choosing to make this announcement at a big addictions conference in Calgary. Lots of experts were there, and how did they react?
Well, I spoke to one expert who said this is a step in the right direction, but she and some others say the government has to do more.
We absolutely need to decriminalize minor possession in this country. Stigma is a huge barrier for people to access treatment and care. People are dying at home alone because they're using alone because they don't want to disclose they're using. Until we decriminalize drugs, we will not end stigma, and it's needed now.
Last week on The National, Catherine, we heard from some mothers of addicts who say that drugs like cocaine and heroin need to be made legal so they can be inspected by the government to ensure they're free of fentanyl. What's the government's perspective on that?
Well, you're talking about legalization, Ian. Even decriminalization is clearly a non-starter. Listen to this exchange today.
Our government has made it clear that we have no plans of decriminalizing drugs. However, we do want to work with individuals, and we want to have innovative solutions to come up with ways to effectively deal with this. Again, it's not just one solution. We have to work with all levels of government and all agencies in order to effectively deal with this. We've made it clear that at this point in time, it's not an issue that we're looking at.
I understand that.
Yeah.
Why not?
Because we are exploring other avenues right now.
So basically the response is we're not doing it because we're doing other things. There isn't really a clear answer there, Ian.
And, you know, even though those mothers I spoke to say they know this would be tough for the government to do, even though it would clearly save some lives. But take us through the political challenge, Catherine.
Well, Ian, consider that even legalizing marijuana, something that most Canadians support, that comes with political challenges. But decriminalizing hard drugs does not have the same level of public support. We're also talking about substances that are much more dangerous than marijuana. This is not something that this government has shown any interest in getting involved in.